My presentation is on the rise of mental illness in prison population. I will talk about the stigma and discrimination inmates with mental illness are subject to, the limited treatment options available, and how the correctional staff are improperly trained. With work in these points, there can be potential for positive change within our prisons. First, I'm going to give a couple of statistics and general information to try and paint a picture of the number of inmates with mental illness in prison. So, upon arrival in federal correctional facilities in Canada, all inmates are screened for mental health concerns using a computerized screening assessment known as COMIS. After the initial screening, over 50% of incoming male offenders require further testing, and 28% of those have a confirmed mental illness. 79% of federally sentenced women were screened, and mental illness came back positive. The rate was even higher, 96%, for Aboriginal women. The percentage of inmates with concurrent mental disorders, meaning that inmates have 2 or more mental disorders at the same time, is over 80%. These statistics are very high, and they have been steadily growing over the past 2 decades. In fact, the number of inmates who are mentally ill have quadrupled since 1998. So, stigma and discrimination. Just to be clear, stigma is a negative stereotype, while discrimination is the unfair treatment of a person because of his or her identity. So it's the behavior that results from the negative stereotype. Inmates with no mental illness see those with one differently. They bully, harass, and make them do things against their own will. Mentally ill inmates generally stay longer for the same crime than inmates without a mental illness. They are at risk for victimization, and often their mental health gets worse because of the living conditions and lack of treatment. Which brings me to my second point of the limited treatment options. If an inmate with a mental illness is acting up during rec time and the correctional officer throws him or her into segregation for bad behavior, that might not have been the right choice for a patient with a mental illness. The brain obviously works different in that of an inmate with a mental illness, and the stimulation of the rec time may have been too much to handle. Putting the inmate away in solitary confinement will only make things worse. The point of this very real example is that there needs to be more options for these inmates. Instead of solitary, maybe taking the inmate to the counselor would be a better option. Or, if the correctional staff were trained in mental health, maybe they'd be able to use some of their skills and education to de-escalate the situation. The easy thing to do is to throw them in segregation, but what is the right thing to do? The incarceration period of inmates is hard to adjust to begin with. Crowded living spaces, lack of privacy, risk of victimization are all examples of a tough reality. But having a mental illness makes these realities even harder. The limited treatment options in prison are reflected in the broader problems such as assaults, violence, and rule violations. All these issues are fused together, and to make positive change, how we treat mentally ill offenders will have an impact on everything else. Mental health needs are just as important as physical needs, and all inmates and staff need to realize this. Improperly trained staff. Mental illness may not be obvious to correctional staff who are not properly trained. Every inmate with a mental illness presents differently, and some symptoms may or may not be visible to the naked eye. As stated, inmates presenting with a mental illness is steadily rising, and correctional staff have no in-depth training. Training at Selkirk Mental Health Center, which is a mental health facility, requires you to complete a 2-day mental health first aid training that does not expire. So if you do it once, you technically do not need a refresher again. You'll have that certificate forever. Point being, a facility that's geared towards mental illness has low requirements for knowledge on mental health. So I can't imagine how the training requirements are for a facility like jail that isn't really geared towards mental health. Implementing certain requirements to make things better, like policies, procedures, and regulations for those inmates who have mental illness will improve the quality of life for all inmates. Adding more treatment planning such as dialectical therapy behavior, psychiatric consults, and ongoing treatment therapies on an as, if, and when needed basis would be helpful. Right now, psychiatric counselors are used when an incident has already happened. To be proactive, it would be nice to have these counselors available 24/7, which may prevent an incident before it happens. We need to use more than just segregation and close supervision. We need well-trained mental health professionals who will upgrade their training on a yearly basis, access to medical records and current status of inmates, and better treatment plans that include a range of helpful cues to aid in inmates with mental illness. Because working in prison is quite a stressful job to begin with, promoting mental health within the institution will make the job less difficult to work in.